it's never been taught in Iowa. So
sounds great. So I'll just start by introducing you, James Waslaski, and say that, are you ready? Can you hear me well?
I can. How about the lighting? Everything's good here?
You look fabulous and maybe a little sleepy.
I'm a little sleepy. I just got back from the dentist, so I'm kind of like post-dental oral surgery stuff. So yeah.
Well, welcome to Dancing Prairie. You can see Dancing Prairie a little bit, I guess. And I'm excited that you're going to be here in person in February 6th, right?
Yeah, it's going to be awesome. I think it's going to be really a cool workshop, something I've never taught. In fact, the course we're teaching, the kinetic chain knee, we've only taught it 3 times in 2020. So the first day has never been taught in Iowa or anywhere around the world, actually. So it's pretty exciting stuff.
Excellent. I feel honored to be bringing you here for that. So I'm not sure anybody really understands what kinetic chain for complicated knee conditions actually means. So if you just start with sort of defining.
That's funny because I brought out a skeletal model and I was bored during COVID. So I painted the ankles purple, the knees yellow, the hip joint red, the SI joints green, the lumbar thoracic spine blue, and the occiput red. So what I'm going to do is I'm going to go through and just explain what happens, why kinetic change. So say we're going to treat your knee pain, right? But your foot, which is this foot and ankle joint, your foot overpronates, say that happens. So that drives the knee medial. And so what I'm explaining to the people is that if the foot overpronates and drives the knee medial or valgus, it puts a load on the medial collateral ligament. It compresses if I go to the backside, it compresses the fibular nerve. It compresses the meniscus. So, and if the hip isn't right, we're going to get into things like a lot of Eric Dalton stuff. We're going to get into iliosacral upslips. We're going to get into iliosacral torsions, which create functional versus anatomical leg length discrepancies. We're going to show people how to relax ligaments around the sacrum so we can get the iliums to move properly around the sacrum and level the sacral base. That's going to reduce ascending scoliosis of the lumbar spine. So if we bring my little friend back in here, when the iliums go out of alignment, the sacral base goes unlevel. That causes an ascending scoliosis of the lumbar and thoracic spine. What that ends up doing is it ends up locking down the occiput. So when your neck comes forward, your occiput comes back and it jams the basilar artery, it jams C1, so C1 can't rotate over C2. So when it goes to the kinetic chain, your neck problem might actually be a foot problem. 90% of knee pain, as most people know, come from the hip and the foot. So when we get into the knee, which is really amazing. Oh, and by the way, I did all new handouts. I brought a sample of what we're going to be giving everybody. These are just done during COVID. There's about 100 colored step-by-step photographs in here. Step-by-step, detailed explanations of what everything's doing. The handout alone is worth the weekend course. I mean, it's all updated.
My students love that. Yeah. Pictures and
very visual, very graphic.
Sort of a recipe.
Well, it is kind of a recipe, but it's also talking about speed bumps. So an example, if you've got a sprain or a strain and you're about to stretch a muscle, your assessment would tell you not to do that technique. So we have a recipe, but then we have speed bumps that prevent you from breaking the code of ethics, which is doing harm, which is causing pain to an already pre-existing condition. So an example would be is if we try to stretch your hip flexors and there's a hard infill. I have new research from John Sharkey, from anatomist from Ireland, that says a lot of these adhesive capsular patterns in hips and shoulders are actually scars, secondary muscle guarding. They need more positional release techniques. They need more strain counter strain techniques. They need more gentle rocking to allow us to pull fluid into the joint capsules of the shoulder and the hip. And we will be visiting the shoulder because it's part of the kinetic chain. So even though this is a knee class, when we get into the shoulder, we're going to be looking at things like adhesive capsulitis, which again is usually scars and secondary muscle guarding. We're not going to do the mortar and pestle thing we used to do when I used to go to Iowa. That's totally changed and transformed. It's more positional release, pull fluid into the capsule, positional release, hydrate the capsule, the movement comes back. So the stuff that I've updated since COVID is like beyond imagination. Like they're going to be so blown away because they said, well, 2 years ago, in fact, last year I had 130 people signed up for the AMTA Iowa conference, and we were going to launch this new stuff to 130 people at the AMTA Iowa conference, stuff they'd never seen before in Iowa, which is really brilliant. And then we're going to get into why I hate the word runner's knee or jumper's knee, because we're going to tell you that it could be your patellar tendon, it could be your medial collateral ligament, it could be your lateral collateral ligament, it could be anterior cruciate ligament, posterior cruciate ligament, could be, if I go deep, the meniscus, could be the tibial nerve and the fibular nerve, could be a jammed fibular nerve, could be your IT band. We're literally going to sort out, is that lateral knee pain coming from the lateral collateral ligament? Is it a ligament sprain or a torsion? We're going to sort out, is it coming from the IT band? And the worst thing for IT bands is forearms, elbows, and foam rollers. So we're going to be doing cupping and vacuum therapy techniques that Anita Shannon says are anti-inflammatories, antioxidant, neuromodulators. I'm just like psyched because when we say kinetic chain knee, you're right. They don't know what the kinetic chain is. So what the ankles are doing affects the knee. What the knee is doing affects the knee. What the hip is doing affects the knee. What the ankle, knee, and hip is doing affects the spine, the neck, and the shoulder. We're going to show images. Eric Dalton has sent me graphics that show which bones rotate in which direction. And then I'm going to tell you why we're going to be like an osteopath or chiropractor, but not doing joint mobilization. When an iliosacral torsion is there, what we're going to do is outflare the iliums to relax ligaments, which is called positional release of the articular ligaments. Then we're going to stretch the ligaments, and then we're going to restore the 5 millimeters of iliosacral motion, which levels the sacral base. That one technique gets rid of all the SI joint pain. Like it's stuff that it's just, I had 9 months to study, and really raise the bar. And you're going to be one of the first people in the United States to host this seminar live, which is really pretty cool.
It is.
It's part of the real world now with Zoom. One funny you mentioned that because one of the things we'll be looking at is the role of the tibia and the talus where this happens. We'll show them how to get that more effectively moving, the calcaneus and the talus. And here's the thing, people go, well, you can't mobilize the talus bone. And I go, I don't. Here's what I do. Here's what we're going to learn. Robert Libby in Canada is a world leader on ligaments. During COVID, I reviewed his ligament book. Okay, so I'm now pretty brilliant when it comes to articular ligamentous referral pain patterns. So if an ankle's not moving, what we're going to be doing is shorten ligaments, which is really called positional release of the articular ligaments. We're going to be doing gentle rocking to reduce secondary muscle guarding. That's going to improve joint space, which is going to quickly improve and balance joint function. So now you get to think in the mind of an osteopath, which I do teach 2 osteopathic conferences a year in Ireland, although I can't go there right now, but I'm going to show you what I would teach the osteopaths. I would teach them how to relax ligaments, relax muscles, improve joint space, improve joint function. We're going to look at that ankle joint, the knee, the SI joints, the shoulder, clavicular rib spaces. And now keep in mind, this is a kinetic chain knee class, but when you balance out the whole body, everything feeding the knee is out of the picture. So then we assess the knee. Then we look at ACL, PCL, MCL, LCL, and you have a test for every structure, right? So there's 13 different things you can treat in the knee, and we're going to show you how to evaluate, treat, and do corrective exercise for all 13 knee conditions, which is, I'm just psyched because I've never taught this much information in any one weekend. And I'm speaking fast now because I'm excited, but I'm going to actually not be caffeinated in the seminar. So we have 2 days to cover what I'm doing on two-hour Zoom classes, right?
This is going to be wonderful.
So there's only 4 therapists in the room. The last 4 months, there's only been 4 to 6 therapists. So I'm like at every table. It's like a one-on-one training. If I could get in a room with Eric Dalton with only me and 3 other therapists, I mean, I'd be all over that. Yeah. So the idea, we may have 6, we may have 7, we may have 8. Right now, we only have 3 or 4. And we're hoping to get 6 or 7 or 8. And the one-on-one mentoring opportunity is going to be beyond amazing. The thing is, social distancing precautions. I had to get tested twice in December. I had to get tested for COVID to fly to Hawaii. I had to get tested to fly to Pennsylvania. So just so you know, even though you're seeing me travel a lot and do small classes, you can feel incredibly safe. Temperatures, masks, distancing of the little tables, the little rooms. But I tell you what, back last year, there were Iowa alone had 130 people in my class. So you're basically seeing me up on a podium, two being screens, you're in the back of the room, no interaction. So right now, I tell you, World Massage Festival in 220 had 180 people in my class. You probably won't even get to talk to me. And so people are going, I like that. I like basically COVID's done some brilliant things for me. It's made me a more spiritual being. It's made me more humble. It's made me appreciate the greater things in life. And that's what you're going to be seeing me bring to these seminars moving forward, which is really a blessing for everybody.
For everybody, indeed.